You're listening to the Patient Experience Blueprint with Intiveo. Hello, everybody, and thank you for joining us again. Welcome back to the Patient Experience Blueprint. I am here again with Monica Watson from Blossom Dental Consulting. Today, Monica and I are going to be talking about the key to a thriving dental practice and really focusing on happy patients and happy staff and how those correlate with each other. So Monica, if you wouldn't mind introducing yourself before we hop into some questions.
Yeah, of course. So I'm Monica Watson. I am with Blossom Dental Consulting. So Blossom Dental Consulting just celebrated its 5-year anniversary. So I've been involved with them for 5 years. And before that, I was in the dental industry for 19 years. So 24 years so far in dentistry. It's my 9 to 5 and sometimes and beyond. And what I love about being in the dental practice is going into a team, seeing what their potential is, and then helping them see it and then get there. And one of the things I also love to do is to kind of keep an eye on what's happening within the dental practices, some things that are evolving, what is new, and also just being in the practice and merge with the team and building relationships there. So I'm excited about being on the podcast today. I did this once before earlier this year, and I think we have a really good topic that we're going to talk about and kind of explore. So yeah, thanks for having me, Megan.
Thanks for joining again. So speaking of the topic, I think we can just jump right into our questions. Could you explain the direct correlation between staff satisfaction and patient satisfaction?
I think this is a great question because if you're a patient and you're lying in the dental chair and you can feel energy in the room, and if you're feeling some tension between the dentist and the CDA, or if you're feeling tension between the front office and the back office, or you're like, something's going on in here, you can kind of catch on to vibes. So if you don't have a happy team that you're working with, patients are definitely going to pick up on that. And they're already anxious as they just on their own coming in. There's nerves, and nobody loves going to the dentist. So you add on top of all of that anxiousness and anxiety, you're not feeling comfortable. You're feeling like maybe the person working on your teeth is having a bad day. They're grumpy. It's really disheartening to feel, okay, this is the person that's taking care of me and they are unhappy. It's not a place that you want to go back to. So I think it's really important for teams to focus on having a happy environment so that patients can feel that when they walk into the office, and that they can feel like you're there to take care of them and that you're not absorbed into some sort of office politics that are happening.
Okay, I can imagine going in somewhere. I don't get super nervous at the dentist, but I don't know, I don't really know what's happening, especially if it's like something outside of a cleaning. And I'm thinking if there's really negative energy between the dentist and the front staff, all I'm thinking is they're focusing on that and not on my teeth, and I want to get out of this chair right now. So how do you think high staff morale can translate into patient care or better patient care for that?
I think it is important to kind of reset daily, because when you come into the office, I think it's good to check in with your team, whether that be through a morning huddle or a conversation in the lunchroom. How's everyone doing? And really check in. And a question that I love asking coworkers or even the dentist or anyone on the team is, how can I support you today? What can I take off your plate? What's stressing you out that I can help and support you with? Because if people feel like their team members are have their best interest, and they're really are sympathetic to how you're showing up, then it kind of takes off that burden of, okay, let's just leave whatever happened over the weekend, let's leave it there. And I know that my team has my back. If I'm starting to run behind, for them to say, you know what, if you need anything, I'm here for you. Just, let me know, and I'll run into the op and support you, or vice versa. I think that kind of takes a little bit of, okay, well, if anything negative happens or the day gets stressful, I know that I can count on, Anne at the front desk, or whomever to support me. They're not going to be like, oh, you again.
Yeah.
Uh, so I think it's important to have a support system within the team and to start the day with, you know,
Positivity.
yeah, definitely positivity. It sets a tone for
Yeah.
the day, but I think it's something that builds over time, right?
Mhm.
If you have a lot of good days, and it builds the office culture up. And even if no day is perfect, but just knowing, if something goes wrong, get emergency or things get challenging in the chair, things take longer to do, that the rest of the team is going to pick up part of the slack and calm the patients that are waiting. They're not going to be at the front desk saying, "Oh yeah, they take forever. They're so slow." Like you don't want you don't want that happening in the office. You definitely want your team members to support you and build you up. Just say, I've heard team members say to the waiting patient, you know what, they are working so hard in the back taking care of this patient, and when it's your turn, they're going to do the same for you. Like that's a more powerful statement than saying they're running behind, like they're having a
I
really bad
agree.
day. Like keep it positive.
Yeah. One thing that we actually do on my own team at work, and we haven't, or I've never had this at any of my other jobs in the past, is we have a standing morning meeting every day each week. And it's usually doesn't take very long, but we go through our top three priorities for the day, but then we also have to share a piece of good news that either like happened to us that weekend or
I love
something to look
it.
forward to. And one of my coworkers recently said, like, my good news is the fact that we have this good news, because when I'm thinking of what I'm going to say, I start going through my head and thinking of all the great things that are kind of going on in my life for exactly what I have to look forward to. And it's just so nice to start off with that little bit of positivity. And I think too, it really helps build your relationships with your coworkers or with your staff, because you kind of know what's going on. Oh, like Megan's sister just had a baby, and it just really kind of connects you. And then again, that's connecting your practice. So I wanted to see if you had any examples of practices that did successfully improve both their staff and their patient satisfaction through that strategy, or any other strategies that you recommended to them.
I think with one of the most important things to make improvements is to kind of gauge where you're at. And I think something that's really could be overlooked, that's really simple, is just asking lots of questions. And this can be with your team. What challenges are you having right now? How can I support you in those? Or what's going really well? And even when you lose a member, because I know there's a lot of turnover for offices right now, just having like an exit interview, um, find out what reason that they're leaving. Is it something like they're moving, or is it something like they really weren't happy, and find out why? And it's kind of a hard question to ask, but I think it's really important because you kind of want to set yourself up for not repeating that same situation again. And I think it's really powerful when leaders are able to ask questions and also create an environment where other team members feel like they can honestly answer those questions and say, you know what, I've been really stressed out lately because of I think that there's a lot on my plate and I feel like I can't keep up. Even just being able to be truly honest and vulnerable and say, I'm struggling and this is what I need help with. I think most employers, or certainly a supportive boss, is going to say, be glad that you're able to share that information and see how we can problem solve together. I think that's huge, just asking questions, because I think so often we're just so focused on our to-do list that we're not really checking in with people to see what kind of support that they might require.
Yeah, and how the people that are doing that to-do list are doing.
Yeah, but it
Little
even
thought.
goes like the reverse too. Maybe an office manager or dentist has a lot of stress or things on their list too, but having team members, go up to them like, is there anything that I can help you with today? Is there
Yeah,
anything I can take off your plate so you can focus on uh, priorities that might have deadlines?
yeah.
Um,
I think too, like doing those like daily check-ins or just like catch-ups, you know what's going on in people's personal lives as well outside of work. And you're like, oh, you know that, okay, they seem kind of down. It has nothing to do with me. or they're in a huge rush, it's because they have something to do to get out of here right after work, and this kind of slowed them down and they're a little bit frustrated about that. I think, yeah, just knowing what is going on with your team is kind of imperative.
Well, some people are, you can tell right away what's happening in their life, and other people are more private and they could
Mhm.
be going through a lot and say nothing. You have no idea. And then there's some that won't stop talking about it. So you can definitely have a range
Yeah.
of things. And it's good to kind of like be able to share with each other things. You don't always have to get into details, but um,
I think I'm an employee who can't stop sharing about my life.
and it's good. Like it's nice that you feel like you can share with people that mean
Yeah.
you know have some closeness and I think it's great when teams build friendships and get along. That definitely helps create a more productive team when you have really good relationships amongst team members.
Speaking of, I mean, there is effective communication and there's ineffective communication, but speaking of effective, what do you think, or how do you think that effective communication within the dental team affects the way the patients are treated?
This it very easily could become apparent because I think when um, you're in the chair, the clinical team might say, you know, is this pre-treatment? Where's the consent form? Is it pre-authorized? Is the patient quoted? Like there's so many things they need to know. And it looks chaotic and everyone kind of looks a little bit dumb when they're running around at the last minute trying to figure out logistics of did this get done? Did that get done? So if you don't have an effective communication system, like the patient's going to notice and they're going to think, oh, this office isn't very organized or good. And it looks negatively on the kind of dental work you provide. If you might make beautiful crowns and fillings, but if your office is scrambling and it looks chaotic and unorganized, your patient's not going to have any confidence in your abilities and not
Which,
really want to refer anybody or maybe even stay
yeah,
in there.
I
Um,
I had a friend who was going in for a surgery and then for some reason had to cancel it. And the day of the surgery, when they weren't in surgery, they were at work or wherever they were, they got all of these post-op texts sent to them. And my friend was just like, I'm canceling this. They didn't even know that I canceled this original appointment and moved it to a later date. I don't know how well I trust them to operate on my face. Um,
right?
I think, yeah, I mean, that could have been a communication error. It could have been just someone forgetting to cancel the reminder text, but regardless, there was a patient loss there. And then I just wanted to chat about like managing staff stress and kind of preventing burnout and like how that also contributes to better patient interactions.
I mean, I have an office that in the last week or two, one of the administrators said, you know, I'm really burnt out. I'm stressed. And I think she's 60 or close to it. She's like, maybe I should just retire. And I'm like, oh no. Like, how
Yeah.
can, like, don't do that. We need you. How can you support your teams again, just what are your stressors and how can your team support you? What things can we remove from your plate? Or even just sometimes it could be as simple as I just need a vent. Like they're
Yeah.
just
Yeah.
frustrating as just having listening and letting it out and just having some empathy and understanding and say, you know what, that must be really hard for you. Like thank
Hmm.
you for sharing. I even today I was in an office and I had overheard an administrator talking to a patient and the patient was frustrated with her insurance and the administrator was just listening and just the sounding board. Like there wasn't really anything that she could do. It
Do.
was just like just showing, you know what, I care. I'm listening about you, and that like that must be really awful to experience that. And
It's also just like showing basic empathy, but then also like the person working at the front desk was probably saying something along the lines of like, I've seen this so many times before doing what she does. This is so frustrating.
mhm.
So I think that kind of just answered a bit of my
should
question,
I
but
should
I
I
want
expand more? I-
I wanted to know what qualities like dental practice leaders should have to make sure that their staff are happy and productive.
Yeah, and I keep going back to kind of the same the same answer, but it's a lot on communication, like asking your team what's important to you. Um, uh, even from when you're hiring, what needs do you have as an employee to, or even asking them what makes a great day? What
Mhm.
happens when you have a great day at work? What does that look like? Tell me about that day, and then see what you can do to kind of keep recreating days like that. Like, you know what, when we had that huddle, we talked about, okay, if a toothache calls, we're going to put them at 4 o'clock today, and then we didn't have to scramble. We just knew. It's just kind of also supporting the team and saying, you know what, if this happens, let's run with this protocol, and just having kind of being prepared for when hard things happen and knowing what to do. I think another important thing is empowering your team to make decisions without having to like keep going back and asking the dentist and interrupting. I think in a dental office, I'm guessing the dentist gets interrupted a lot. They have to ask a lot of questions, but also letting your team know you can make these decisions without me. This is how I would make this decision, so you know kind of how to steer the boat.
Mhm.
Uh,
It
so
also gives us like more of a productive day too. A dentist isn't constantly being interrupted by questions that they don't really need to be asked. If you can just
right.
sort of figure those out at the beginning of the day, the week, of the month, or
Mhm.
person's career. But next, I kind of want to move over to the feedback side of things. I know we kind of chatted about like open community, not kind of, we really have been talking communication and how it affects this practice, but how can practices or practice owners kind of take feedback and use it to effectively improve the work environment and feedback from staff, not patients?
That's a good question. I think it's good to get feedback from them. This one office I'm working with, they're implementing a brand new system, and change is hard. So I think as leaders, acknowledging
Mhm.
when we are making changes, that yes, this is hard. We are going to be uncomfortable. We're all struggling, because that might reduce the amount of complaints where you just acknowledge, yeah, this sucks right now, but if we are able to get this up and running and functioning well, things are going to run so much smoother. Also, asking for feedback when there's change.
Mhm.
How are you doing with this? Do you have any suggestions? Being able to, again, allow employees to feel comfortable actually sharing what they're going through or feeling, and listening. I think leaders, so managers and dentists, need to create environments where they can ask the questions and they can receive the answers without kind of lashing out or saying, you know what, well, this is my practice, this is how it goes, even if that's how you really think.
I
You know.
remember I was speaking with Melissa Barlock on one of
Mhm.
different episodes. We were talking
Yeah.
about patient reviews and how to um, respond to negative reviews. And I think it's
Mhm.
similar. It's like, don't ignore it. Don't bury your head in the sand. You do have to face it head on and kind of accept responsibility for what happened and just let the person know, okay, I'm aware of this and this is what we're going to do to change that, or this
Mhm.
is what we can do to rectify the situation.
For sure. I think she's right, and that advice is when a patient or even an employee has something negative to say, listen, acknowledge it, try to understand from their perspective, and then work on improving it. I think you got to own your mistakes,
Mhm.
uh, and say, you know what, thank you for sharing that, and bring it to our attention. Now we can implement into our training so that uh, we're able to prevent that from happening again. I think, yeah, the worst thing you can do is just not acknowledge it. But I think when you have Google reviews and you see the owner replies to both the positive and the negative, it does reflect well and shows that, okay, they're acknowledging it. And
Yeah.
and sometimes that's all they need, is just to like vent, just let it
Even
out.
see, yeah, and
Sometimes that ends it.
yeah, I even like, even if I'm looking for a place to eat or a hair salon or something, if the owner is responding with integrity and
Hmm.
class and positivity and they're not arguing with the person in the Google reviews, I always find that is a huge red flag when the owner is really defensive in the Google reviews. So yeah, just again, just like owning what happened and figuring out a solution to what can be done.
Mhm. Yeah.
Do you have any examples of changes implemented based on staff feedback that led to a better patient experience?
Every time you have a staff meeting, you're getting staff feedback. And I think that's part of kind of, greasing the wheel is finding out what's working, what's not, and then making changes accordingly. And so sometimes even I've suggested things for offices and they've tweaked it. So you know what, I think that idea is good, but let's do these changes. And I think when you are trying to improve things and you're wanting to have a better experience for your patient, you do kind of have to take ideas and kind of mold them to figure out how they're going to work well. So you can have a great idea, but maybe someone else on the team has a suggestion to make it even better, and being open to allowing for that and just say, no, that's not what I had in mind. I want to do this, but just allowing them to the team kind of to play with things to figure out what works best. Because sometimes you might evaluate and say, you know what, this idea, on the drawing board, it seemed great, but it's not
Doesn't
working.
actually work in theory. Or
Yeah, and pivot. They didn't give you an example per se, because I'm thinking about the heads of all the times in my head that in meetings we're just always adjusting things, right? There's not one particular thing, but we're always kind of making changes and improvements
gonna
in
say,
all things.
speaking of adjusting, like sometimes something might work for 6 or 8 months, and then someone new joins the team and it's not really working for them, and you're having to constantly adapt your working styles and just the office to make sure that things are running smoothly.
Yeah. And you just made me think too, when you get a new team member, you're training them, but I think also just approaching the thought of, you know what, you might learn something really awesome that they do that you don't do in your practice or have never thought of. And just allowing them to put out suggestions last week I was training someone and I said, oh, I'm going to teach you a few things, but you know what? I'm going to learn a few things from you. Just like making that statement, just kind of making someone who's new and probably really nervous comfortable, so that right away you want to be able to have your employees feel like they can share ideas, because it's when you get all the team members on board with and making suggestions, improvements. That goes from the beginning, even before their first day of work, setting them up to say, you know what, you're gonna be a very important team member. You're gonna bring things to our office that we might not have. So if you have suggestions or things that we could do better, by all means, share with them. That doesn't mean every idea that they have that you're gonna implement, but just allowing them to feel, okay, my opinion matters.
Yeah, I love that, because even in my role, like I've been working in marketing for 6 years now, I think. And so much to do with marketing is like brainstorming ideas.
Mhm.
And sometimes I've thought of the best campaign ideas and they did really well. And sometimes I've thought of something and my team looks at me and is like, what are you even talking about? But I know that how do I word that like my team is really going to support me no matter what. And they're not going to call me an idiot for what I just thought of.
Right.
I'm going to either say, nope, moving on, or okay, how can we take that idea and kind of build off of it? So I think just creating an environment where it is really safe to, yeah, say like, you're not only learning from me, but I'm learning from you, and safe to bring up these ideas for the practice is ideal in any career.
Yeah.
And
Goes
so
across industry for sure.
exactly. That does bring me to the end of my questions. Was there any questions you had for me or anything you wanted to bring up?
I think just to summarize kind of what we've been talking about, I think when you invest in your team and you really try to set them up for success and give them some, room to play and make suggestions and empower them to be able to make decisions, you do build a team that's going to just blow your mind. And I've seen that in action with some teams, with leaders that are uh, they're so caring and they're genuine, and they're like that with their team, but it spills over to the patients, and the employees take on that persona too, where they care for the patients. But as we were talking before, I think if you take care of your team will take care of your patients. Because if your team feels cared for, then they're going to have the capacity to care for your patients. So I think it's really important to invest in your team and support them, allow them to be comfortable, have a open communication and dialogue and continually.
Yeah.
And that does create it's one way that you really do build a culture, and I've seen it in play with lots of practices where the teams are happy and so are the patients. You really get
Pick up on it.
it
And
mirrors
not
itself.
just at a dental office, at a restaurant or at someone's house, I think energy is contagious, positive or
Mhm.
negative.
Yeah,
And
it attracts each other.
exactly. And so when you're putting positive energy into your practice, that's kind of what's being put out by your staff and then being reflected onto your patients. And then usually, not always, but usually that's what the patients are giving back to you.
Right. Yeah. And then they have good things to say about you. But I think overall, just checking in with your team, finding out what their needs are, how you can support them. And I think it's also important to reciprocate that and check in with your dentist and see how they're doing and how you can support them, or even just asking them, on a daily basis, what's the biggest thing that I can help you with today? Or how can I support you?
Mhm.
I think there are some really great questions that we can be asking our teams and leaders. And I think that also overflows into the patients. And I think one question that we can ask our patients before they even come into the office is, what can we do to make your visit comfortable? And it's an open-ended question, and it allows for any type of answer. Maybe they're really nervous, or they don't like the seat going back too far, or they don't like to be told to like, like
Yeah.
maybe they just listen to what they have to say. They're going to tell you what their needs are, both your patients and your team, and we need to listen.
Okay, I think my biggest takeaway from this conversation is communication is
Yes.
key. Would you
Yes.
agree with me on that one?
Yeah, I think there's a really important questions to ask,
Mhm.
and they're generally open-ended questions that really allow for people to speak their mind. But
Mhm.
then the second part of asking questions is listening to the answers.
Which I think people often forget to because, and like myself included, even when you're like introducing yourself and someone tells you your name, you're not listening. Well,
No.
sometimes you're not. And I think, yeah, you focus a lot on asking the question and you're not actually retaining the answer that's being given to you.
Because if you ask a patient, how can I make your visit more comfortable? And they say, I don't like the chair reclined all the way. And then the hygienist doesn't get that memo and does it, then that's almost worse.
I asked the question. Exactly.
Yeah. So it's the
Exactly.
listening part. Is it too, there's two parts of it.
Yeah. All right. Well, thank you so much for joining me today. Did you want to tell everyone where they can find you?
Yeah, I'm online. So blossomdentalconsulting.com. I'm on LinkedIn the most.
I'll pop all of that down into
Is
the
it?
description box as well.
Perfect. Yeah. But if anyone has any questions, they're always welcome to email me, connect with me. That's one of my favorite things to do is to learn about people and their stories and their struggles. You can reach me at Monica at blossomdentalconsulting.com.
Wonderful. Okay. Thank you so much, Monica. I will talk to you soon. And thank you, everyone, for joining.
Thank you for having me. Bye, everyone.